As a patient, I think it's critically important to know the options available to you. Knowledge is your biggest weapon. You're only going to know about what's available to you if you ask.
When we think about primary ACL repair, there's a variety of factors that go into decision-making for me to figure out if that patient is a candidate. We think about the patient's age, their activity level, their sport that they're participating in, their expectations, and their desires. And then we look at the quality of the tissue, the timing of the injury, and we think about all of those things before we make a decision about primary ACL repair.
So it is important to find a surgeon who understands the different types of ACL tears and has spent the time to learn and perform this procedure competently.
So when you're talking about how to repair an ACL, how does that differ from a reconstruction? Well, when you reconstruct an ACL, you have to get the ACL from somewhere, oftentimes from yourself.
The primary ACL procedure includes taking the patient's own tissue and repairing it right back to where it came from. Essentially, the ligament tears off the femur bone in these cases, or off the shin bone, and we're able to place sutures, and these are high-strength suture materials, into that torn tissue and put it right back to the bone where it tore from. Ideally, we're able to invoke a biologic healing response so that your own tissue will heal right back to where it tore from, and you can keep your native anatomy, and your knee is essentially your knee. There's no new parts or used parts. It's your tissue, it's your knee, and ideally getting you back to where you were before you even had the injury.
ACL repair is an exciting area, but it is not for everyone. Of course, the procedure will do well when we align it for the people that we know it is designed for and who are good candidates. And you should talk to your surgeon about that and ask those questions so you can be sure to know whether repair or reconstruction is an option for you.